For over a decade, we have supported our providers who have asked, what if? What if we can create new innovations that improve patient care and outcomes? What if we can collaborate with industry to accelerate the rate of development of new technologies? What if we can use our commitment to safety and quality to improve healthcare for those around the world? Our clinicians, engineers, researchers, and entrepreneurs work side by side to develop, test, and scale the next generation of healthcare technology.
Dr. Vilkens is known to us in Innovations because she's been a stellar contributor to many projects. The one you're going to hear about today is one that's really special to our hearts because of our role of educating not just current innovators but future. She was part of the clinical team that provided observational learning for our Michigan State University graduates, many biomedical engineering students in the first year of that program. And a few months later, LaPowerAssist was born. It is a for-profit company that not only is predicated on that invention, but is being run by Dr. Vilkens and the students themselves. We wouldn't be surprised if you hear more from her in the future.
But I had this idea in fellowship. I met with Dr. Duchovsky, who connected me with students from MSU who were doing their PhD in biomedical engineering, with some of them doing a PhD DO combined program because they're insane. Essentially what happened was I then presented my idea, Shark Tank style, to their biomedical 501 class it is. And this group of students really picked up on it. It was amazing. All they needed was my clinical input, and then they just ran with it. I would give my clinical input, and then they'd revamp it. For that first year, we were having meetings maybe every month, and then they won the class project, and then they got a little bit of seed funding from that, which then allowed them to rework the prototype to get it to a perfect spot where we were able to approach Spartan Innovations and get connected with different VC companies and whatnot that we're all still going through talks with, but it was a really great collaboration, and can't thank the Innovations Institute enough. It's a pretty special thing to Henry Ford, and I think it certainly contributes to the powerful culture that we have, and I think particularly given the relationship we now have with MSU, I mean, the opportunities are endless.
Healthcare is changing faster than ever. Artificial intelligence is transforming how we diagnose diseases. New devices and digital tools are redefining how care is delivered, and breakthrough ideas are emerging from every corner of medicine. At Henry Ford Innovations, we turn those ideas into real solutions.
So when I saw this particular device, I was like thrilled. Why? Because this was the missing piece. It brought in a non-invasive way of assessing, and it strengthened that part where I can objectively say the axis which was there 1 week ago has now changed. We have to understand where this all started, right? Henry Ford Innovation was actually meeting with few people in Israel around the same time. So I made those two connections. I said, maybe you guys should go and talk to each other there, right? And the rest is history. The excellent ecosystem that Henry Ford Innovations has created. Without this ecosystem, we couldn't have been where we are today. It greatly helped me to actually communicate to the VCs and their advisors. And so overall, it helped both for, I think it was a win-win situation for everyone. What it does is it's not only assessing whether there is blood flowing through this axis, but it has the potential to say if that flow has become different compared to last time I scanned it. Okay, is it showing to have a problem in the next 48 hours, or 6 weeks, 2 weeks, whatever, right? And our mission has always been to provide the best quality care and with the latest information and technology that we can use. It looks at the trend, it looks at the problem, identifies the problem, or it helps to make the right decisions, and it evaluates if the treatment was done appropriately or not. And if it hasn't been done appropriately, then it will alert everybody that you need to do something else. It helps, aids, and abates all aspects of access care. And so it's not just a one piece, it's a one piece for a variety of things that we're just scratching the surface at this time. Oh, this is cool. I can see what's going on, right? It's the empowerment of the patient, for the patient. That's what I'm hoping for with this new device.
Through the Henry Ford Health plus MSU Innovation Hub, we are accelerating startups, advancing AI, and bringing bold new ideas into the clinical environment. We are so proud to announce the Henry Ford plus MSU Innovation Hub. At the end of the day, this is all about providing better care to our patients by accelerating new solutions and fostering inclusive economic development here in Southeast Michigan.
The MSU Henry Ford Innovation Hub is a bold initiative. We're really excited about it, bringing together two great organizations with expertise around clinical trials and startup experience.
At Henry Ford Innovations, our mission has always been to identify new technologies and solutions that help us provide better care and outcomes for our patients. This is yet another opportunity for us to identify cutting-edge technologies that are being developed all around the world and bring them to Henry Ford to partner with us and launch them into clinical use.
We have a rich history of working with startups around the state, supporting over 300 companies today. We're excited to bring that technology and that experience to bear with this new hub, partnering with Henry Ford and their clinical innovation opportunities, as well as their innovation teams can learn from each other.
One component of the Innovation Hub is a $10 million investment fund that we have established. This is to invest in seed stage companies with the potential to improve patient care and population health.
We've had an exciting 2 years of working together and supporting new startups, from a new accelerator to health challenge grants that we put in place. So we're positioned very well as we launch this new hub. It's exciting to take the lessons learned, put them in place, and drive health innovation to another level.
There is no better place to test new technologies than with the clinicians who are engaged here and in the clinical environment that we provide.
There's many hubs around the country that support health. We want to be recognized as one of the best. And I think the combination of the resources and the talent and the international reach that both organizations have, this is going to be an exciting opportunity for the state of Michigan, and we're looking forward to the impact we can have on entrepreneurs around the world.
Henry Ford Health has a century-long reputation of innovation in healthcare. This is the next generation of our legacy.
Our patient had a problem that is very challenging to treat with traditional surgery and radiation. That was the prompt for us into sort of innovating a different solution because we didn't have another one. You know, and at Henry Ford we have a brain brachytherapy program. You know, we often take out tumors and then we will put in radiation sources down in the brain to keep the tumor from coming back. There's FDA approval for that in the brain. The innovation here is applying this technology that we typically use in the brain to the spine. And we have to do it in such a way that we can, at least to the best of our ability, plan meticulously and ensure safety or optimize the likelihood of a safe and good outcome. That's where the 3D model comes in. And so we needed to make sure we were going to be giving enough radiation dose to the multiply recurrent tumor and not reaching toxic doses to the nerves that were traveling right over the top. First, we looked at a three-dimensional model and then brought it in and talked to Alex, right, in the Innovation Institute, our master of 3D printing. And so she was able to print up full-scale models, beautiful full-scale models for us so that we could take it down to the anatomy lab and actually simulate, do a surgery on the model. That's where I think the 3D model was pivotal. It was basically a step that established feasibility for us to go to the OR and actually do the surgery.
Hello, I'm Vikas Relland.
And hi, I'm James Adams.
Through our partnership with Michigan State, we're utilizing capstone projects to help solve healthcare issues that are brought to us by our clinicians.
Capstone projects are a collaboration between Michigan State and Henry Ford, where a group of 5 or 6 students help solve a problem that Henry Ford has, and at the same time provides a real-world experience for the students at Michigan State. It's very much a win-win for both entities.
For example, Henry Ford Health does not have a computer science engineer on staff. Michigan State has many of them, all learning the latest technologies. We can take data to these students, they can manipulate it into a dashboard that's usable and helps push us forward.
And it doesn't have to be just computer science students or engineering students or health science students. This can be a College of Arts and Letters where they help us with art therapy and different aspects that would really help patient care or patient just well-being within the health system.
We like to say at Henry Ford, just because you're not a clinician doesn't mean you can't impact healthcare. We also say patients first. Michigan State says students first. Here at Henry Ford, through our capstone projects, we can do both.
We love the energy that the students bring to our projects. It's been a really good experience for Henry Ford and for the students.
Through Henry Ford Innovations, we are able to bring these students on campus, show them some of the education that our clinicians go through, as well as relevant aspects of the project and problem that they're trying to solve.
The innovations team is really proud that we can help make this firm connection with Michigan State as part of our partnership.
Henry Ford has a legacy of collaboration. Here at Henry Ford Innovations, we're here to solve your problems.
If you have a problem that you think can be solved by a capstone project, send it to us. And then we'll actually take a look at it, see whether it fits a capstone project that students could work on, and connect you with the right people at Michigan State to make that happen.
Through our relationships at Michigan State University, we can get this done. Go green.
Go white. Go Henry Ford.
It's great to be back here, and every time I'm in the Innovation Institute, I'm inspired and I leave hopeful. Because this is about advancing and doing things other people, quite frankly, aren't capable of doing.
Innovation is important. And it's not just for me or our team here, it's for all of us. We're going to show you today some innovations that happened in a nursing unit. And in front of me is Shirley, which is a 3D printer. And you might think, oh my gosh, this is technology that is space age, it is unattainable. This is a $500 device.
It's unbelievable.
We're going to show you how simple it is. Bob, this is so simple, even a CEO can do it.
I knew that was coming from you, Scott.
All right, welcome Bob. My name is Alex Masheri, and I'm a 3D printing expert here, along with Leo. We also are product designers. So this is our new 3D printers. We are hoping to expand this to other units throughout the hospital. So we can do device creation here, as well as pre-surgical planning prints. And so we're gonna kind of take you through that.
As an example today, we're going to show you how to print out one of these EVD clips. This was designed by a nurse in the neuro ICU. They put these on the machines to stop the EVDs from coming out, which lowers infection risk.
Can I just stop you right there? Think of how cool that is, that a nurse on a unit is empowered and inspired to just problem solve in a way that takes advantage of the unique things that we have within Henry Ford Health. That just makes me so happy.
It's so amazing. Every time an invention disclosure comes in, it's great that people are thinking about creating solutions to help the health system.
Yeah.
It's such a wonderful thing.
That's our culture at
Yeah,
work. Oh,
it
that
is.
just warms my heart.
Yeah, truly. So this is an FDM printer. It uses a spool of filament, and it deposits that filament in layers to build the model. The design is created by us at the Innovation Institute, and it's sent from us remotely to the 3D printer. And once that file is set, they can print the file out on demand whenever they need. This is a roll of filament, and that gets loaded into this automated material system here. So I can hand this off to you and I'll kind of walk you through it. Okay. But so you're just gonna set the filament inside of there, run that through again. Perfect. And then you're gonna take the end of the filament.
All right.
And then you're going to push this in and feed it through. And now we can see we have our white PLA plastic loaded. The next step would just be to select the print file if you want to click on there. And then lastly, just hit print, just like a normal printer.
That's incredibly easy. And easy with high impact, that's a great combination.
The future of healthcare won't be built in isolation. It will be built through collaboration. Collaboration between health systems, universities, innovators, and industry. I'm Lisa Prasad. I invite you to join me as we harness the power of innovation to make the impossible possible.